All right, today we're diving into a really serious medical emergency, one that moves incredibly fast and is often misunderstood. We're talking about sepsis. And here's the first thing you need to know. It's not the infection itself. It's the body's chaotic, over-the-top, self-destructive response to one. It's when your own defense system just goes completely haywire.
So just imagine that for a second. Your immune system, which is basically your own personal army, suddenly gets so confused that it can't tell the difference between the enemy and, well, you. That right there, that's the fundamental crisis of sepsis. And if you can understand this internal battle, you're on your way to understanding the danger.
So, let's be super clear on this. Sepsis is not the infection. It's the body's catastrophic overreaction to the infection. The best analogy is friendly fire, but on a massive body-wide scale. The response itself becomes way more dangerous than the original problem, and it starts causing real damage to your own vital organs.
Okay, so if this crazy battle is happening on the inside, how does it actually show up on the outside? Well, the body starts sending out these massive alarm signals, but you have to know how to read them. So let's break down exactly what you should be looking for. You know, in the medical world, this out-of-control alarm system has a name. It's called Systemic Inflammatory Response Syndrome, or just SIRS for short. That's the clinical term for when the body's immune response goes from being a precise targeted attack to a full-blown body-wide state of emergency.
Now, check out this comparison, because it makes it so clear. Normally, right, your immune system fights an infection right where it is, like at a cut on your finger. But with SARS, that fight goes everywhere. It's systemic. Doctors are on the lookout for at least two key signs. Your temperature is either way too high or strangely low, your heart is racing, you're breathing way too fast, or your white blood cell count is totally out of whack.
And this part is so important to get. The very first clues can be incredibly subtle. Before someone is obviously confused or looks really sick, you might just notice that their breathing seems a little too quick or that their heart is pounding for no apparent reason. These can be the absolute earliest warnings that the body is in serious distress.
You see, sepsis isn't just a single thing that happens. It's a crisis that escalates, and it escalates fast. Think of it like a 3-act play, where every single minute counts and each stage gets progressively more dangerous.
So here's how that progression looks. Stage 1 is just called sepsis. That's when you have a confirmed infection, plus at least 2 of those alarm bells we just talked about. But from there, it can quickly ramp up to severe sepsis. This is where organs actually start to fail and you see scary signs like sudden confusion or a big drop in blood pressure. And the final, most dangerous stage? That's septic shock. That's a state of collapse where the body just isn't responding, even with aggressive medical help.
Now, thankfully, medics have tools to spot this escalation early. There's one number in particular that's a huge red flag. It's called end-tidal CO2, or EtCO2, and may get it just from a patient's breath. When this number drops below 25, that's a major signal that things have likely progressed to severe sepsis.
So why is that one little number so important? Well, because it's basically a stand-in, a proxy for measuring high lactate levels in the blood. And high lactate is a dead giveaway for organ dysfunction. It means the body's cells and tissues are literally being starved of oxygen, and they're starting to shut down. So you might be thinking, can this happen to anyone? And the answer is yes, absolutely. But certain people and certain conditions make someone much more vulnerable. Knowing these risk factors is really key to being vigilant for yourself and for the people you care about.
The list of risk factors is actually pretty broad. I mean, any active infection, something as common as a UTI or pneumonia, can be the starting point. Same goes for open wounds, or if someone's just had surgery. Having a medical device inside your body is another one. But a really big vulnerability is a weakened immune system, whether that's from diabetes, chemotherapy, or other chronic issues, because it just leaves the body less equipped to handle that initial fight.
Now, there are 2 groups that need our special attention: the elderly and children. For an older person, sometimes the very first sign isn't a fever or a racing heart, it's new confusion or a sudden change in their mental state. And for anyone who's just had surgery, if their pain is getting worse when it should be getting better, that's a massive warning sign to think about sepsis.
And for kids, the risks are often tied to health battles they're already fighting. A child with cancer, or one who has sickle cell disease, or who's recovering from a major transplant, their immune system is already under a ton of stress. And that means an infection that might be manageable for another kid can spiral into sepsis really quickly. It makes being vigilant absolutely critical.
Okay, so once sepsis is on the table, once it's suspected, what happens next?
Well, it's an all-out medical counterattack, and the entire goal is to support the body and slam the brakes on that cascade of damage.
The immediate goals here are super clear and super urgent. First, get them on oxygen to make sure the blood is getting what it needs. Next, start large IVs. You need a direct highway to deliver fluids and medicine, fast. Those IV fluids are absolutely crucial to get blood pressure back up and restore blood flow to those starving organs. And finally, you have to carefully manage their airway to support their breathing.
But here's the thing, it's a very delicate balancing act. This guideline here really shows you how careful doctors and nurses have to be. Pumping in fluids is essential, but giving too much can actually flood the lungs. That's especially risky for patients who already have heart or kidney problems. It means they have to constantly check and reevaluate.
When you boil it all down, it really just comes to this one simple truth. With sepsis, time is tissue. Every single hour the treatment gets delayed, the risk of a bad outcome goes up dramatically. So, early recognition and immediate action, those are the most powerful weapons we have in this fight.
Look, sepsis is a terrifying enemy, no doubt about it. But it has tells, it has warning signs. That race against time doesn't start in the emergency room. It starts with the very first person who realizes that something is seriously, dangerously wrong. Now that you know what to look for, that person could be you.